Hello, we want to have a discussion in an area in research, an issue that quite often offers significant challenge to upcoming researchers, especially those who are writing their research project either at undergraduate or postgraduate level. This is what we call gaps in research. Quite often, students or researchers are asked to state what gap exists in their study and for which they feel that by undertaking the study, they are able to fail. So today, I want us to look at the types of gaps in research so that when we are undertaking any research, it becomes clear in our mind about the gap that exists in the type of research that we want to undertake. And therefore, we believe that by undertaking that research, the findings of such research would be helpful in terms of filling the gap. We want to have an overview what a gap in research is. A research gap is an area in a field of study where there is not enough information, and information may not be enough due to a number of reasons. One could be the evidence that's available is not quite clear, or the data that's available relates to issues that were done much long time ago, and therefore it's outdated, or simply what's available is inadequate. It's not comprehensive enough, and therefore cannot provide conclusive findings. That becomes a gap. Or sometimes what is available is not appropriate to a given area. Or sometimes the kind of methods that were used to collect data might not be appropriate, and therefore the kind of information it delivered may not have been as good as if other methods were employed. And therefore, research gaps are seen by researchers as opportunities for further studies or for undertaking new studies. And this, therefore, will help in filling the missing pieces and therefore move the field of study forward. Recognizing these gaps ensures there is relevant information, and also we add additional knowledge to existing knowledge. Findings also would help in terms of answering important questions that previous researchers had not explored. Then this, in overall, has the potential of enabling that field of study to grow and therefore provide solutions to emergent issues or challenges, which could also help in terms of formulating policies to address problems that exist in society. Gaps can come in many forms. One of them is what we call evidence gap. An evidence gap comes when research findings contradict each other, and that makes it difficult to form a clear conclusion. Take the case, for example, where different studies on the same issue are yielding different findings, or what we call conflicting findings. For instance, the influence of parental alcohol consumption behaviors on adult children's drug and substance abuse. Assuming that is what's available, and indeed several studies have attempted to understand why or whether children who come from families where parents consume alcohol or abuse alcohol are likely to also show the same behaviors. Such studies, some research suggests it positively influences, while others find it has a negative influence with the adult children's alcohol and substance abuse. In that case, therefore, there is contradiction in the sense that some studies say it does, others say it does not. In that case, we have conflicting evidence where findings of a given study contradict each other. That kind of study presents a type of gap that we call evidence gap. And this can occur when researchers use different methods, sample populations, or different settings. For example, again, there are instances where poverty can be a contributing factor to drug abuse. But there are also cases where you also find children from affluent families engaging in drug abuse. Again, when you look at that again carefully, there is an element of contradiction. So when you talk of evidence gap, it is simply a gap in which studies that have been undertaken on the same issue are yielding different and conflicting findings. When findings are conflicting, it offers opportunity for other researchers to carry out other studies to see to it that, or to establish whether the new studies are aligning with which type of previous findings. So that is evidence gap. We have another type of gap that we call knowledge gap. Knowledge gap exists when there is a lack of research on a given area which is thought to be essential in advancing understanding and knowledge. A knowledge gap often appears when certain topics are overlooked or underfunded, or when emerging issues have not yet been studied in depth. It also occurs when there is a lack of information or understanding about a specific topic or research area. For example, researchers may not have explored certain phenomena, or they may have failed to develop a comprehensive understanding of a given issue, and in the process, this leaves a gap that future researchers can address. Filling this type of gap in research helps ensure that proposed research builds upon solid, comprehensive information, and therefore supporting informed decision making. For example, if, say, we take the case of drug abuse as an important area of research, there could be studies that are focused on causes of drug abuse. There also could be studies that are focusing on prevention of drug abuse. Another set of studies might be focused on rehabilitation of drug addicts. So that we have three levels of studies: one on causes, another one on prevention, then the third one on rehabilitation. But now the fourth level, there is no fourth level of study. And perhaps there is evidence that some newly rehabilitated drug addicts often go back into drug abuse as soon as, or just a few weeks, a few months after graduating from rehabilitation centers, meaning they are relapsing. But when you read literature, it becomes clear that there are no studies that have been looked at on relapse. What causes drug relapse? So, as a researcher, you might be interested in understanding or focusing on relapse as a possible area of research. So, in that case, therefore, the knowledge gap that exists within the field of drug abuse might now be factors contributing to relapse. That now becomes your area of focus. The other area that suggests a significant gap is what we call practical knowledge gap. And practical knowledge gap occurs when research findings are not applied in real world practices or professional behavior does not align with the research evidence. I want to emphasize that one of the main purposes for undertaking research is to come up with findings that can help for policymakers to address issues that studies have found to be bedeviling society or bedeviling institutions. But sometimes these findings are never, in actual sense, applied in terms of to remedy the situation that exists in our institutions or in society. In that case, therefore, there is the practical knowledge gap. For example, studies might show the benefits of hospital deliveries. There are several studies around the world that have shown that delivery in hospitals have several benefits. But despite the benefits that accrue from hospital deliveries, there are also studies that suggest that women, especially from marginalized communities, still prefer home deliveries. So that despite the benefits that several studies have shown are associated with hospital deliveries, there is still significant proportion of women from marginalized backgrounds that still prefer to deliver at home. The question then is why? That case, therefore, practical knowledge gap exists. In what sense? In the sense that there could be certain factors that discourage women from delivering in hospitals, despite the fact that delivering in hospitals has a lot of practical benefits. There could be certain obstacles that still are placed in front of women that makes it quite difficult for them to deliver in hospitals. For instance, there could be the issue of cost. Even if hospital deliveries are free, in some institutions. The distances between people's homesteads to the nearest hospital facility, especially in underdeveloped regions, can still be quite some distances. Accessibility could also be an issue. Others could also might be to do with social norms. For instance, what belief systems do different communities have with regard to a child born? There could be certain rituals that must be performed to the mother or to the child that is newly born. And sometimes it is feared that such rituals might not be tenable in a hospital environment. And so, fear of not allowing the hospital not allowing such rituals to be performed could be a preventive factor, or could be a factor discouraging women from being taken to hospital for delivery. So when you talk of practical gap, we are basically concerned about some of the issues that makes it quite difficult for certain policies to be implemented effectively, even if the benefits about the implementation abounds. Bridging this gap therefore helps ensure that research has a direct impact on real-world practices and outcomes. A researcher that therefore is driven by practical knowledge gap would perhaps be concerned about factors undermining women's access to hospital deliveries. That case, therefore, that becomes now the gap that would guide a researcher that is leaning towards the practical knowledge gap. The other gap is to do with what we call methodological gap. And a methodological gap arises when existing research methods are insufficient for answering specific research questions. In other words, the kinds of methods that are available currently are not adequate enough to respond to the current research questions. And this gap is recognized by pinpointing shortcomings in the design and methodological instruments employed in prior research. The methodological gap addresses the needs for introducing new ideas or methodologies, research tools or techniques that have not previously been applied within the same study domain. It might also involve the synthesis of multiple methods to comprehensively analyze phenomena, thereby yielding more robust and precise results. The use of new methods or refining existing ones allows for the collection of more accurate, reliable data, leading to better insights. For example, we know that certain studies might yield better results if, say, questionnaires are used. But there are also instances where interviews or key informant interviews could yield even better results. Or there are also areas where direct observation or participant observation would allow the researcher to get more insight into the issues under inquiry, and the process therefore get better results. So when we talk about methodological gap, we simply mean gap that's arising because certain methodologies that are employed probably could not yield certain results. And therefore, researchers might decide to say, what would happen if a different approach to the study is used? Some studies are better done, when we use quantitative approach, others are good when we use qualitative approach, but others are even better when we employ the mixed method approach, that is, applying both quantitative and qualitative approaches. Another significant area of research gap is what we call empirical gap. And empirical gap exists when theories or research findings need to be tested or evaluated in real-world settings. In other words, there is knowledge that exists, but how practical or how applicable that knowledge is in real-life situation remains not well tested. For example, there might be a theory that suggests that maybe close supervision at work discourages innovation and performance, because sometimes there's the argument that workers want to feel free, and when they feel free, when they are not closely supervised, they are likely to be more innovative and even perform better. That's a theory. But how much has this theory been tested in a real work setting? So there is limited empirical evidence supporting this in various workplace settings. So a researcher might set out just to understand how possible is this theory. Therefore, testing theories in real-world settings ensures that research findings are applicable and valid across different contexts. Maybe there could also be theories, for instance, that revising exams in groups probably could offer a better preparation for our students, and therefore such preparation could lead to better performance in examination. Again, that could be a theory. But how much has this been tested? So a researcher might be willing to just compare students who study in groups vis-a-vis those who study individually, and now compare their performances in exams, just to see to it whether it is true or it is false that revision in groups improves or yields better academic outcomes, especially in examinations. That kind of understanding sometimes need also to come out very well. Another important gap is called population gap. And population gap pertains to studies involving demographic groups or samples of individuals who have not been adequately presented or researched in the existing body of knowledge. A population gap therefore occurs when certain groups or populations are underrepresented in research. In identifying population gaps, researchers note that previous studies often concentrate on certain demographic groups while neglecting others. For instance, alcohol and substance abuse often focus only on youth and young adults, leaving a knowledge gap about the elderly or persons with disability. And this gap, therefore, might call in-depth investigation into alcohol and substance abuse among neglected populations, notably the elderly and persons with disability. Maybe I need to take time to explain this better, that findings of studies based on a given population might not necessarily mean that such findings are applicable to populations of different characteristics. And the example that we have given here is that quite a lot of studies around alcohol and substance abuse have focused on young people, the youth, and young adults. The population of the elderly and persons with disability has actually not been looked into much, and therefore there is a gap, a research gap in terms of study population, in terms of the elderly. How does alcohol and substance abuse manifest? How does it manifest among the elderly and persons with disability? That is population gap. So population gap occurs when a certain population characteristic, there isn't much knowledge in terms of research about that particular population. And here I've talked about uh, drug abuse with respect to the aged and persons with disability, since most of the studies largely focus on the youth and young adults. So when a given population, how a given issue manifests in a given population is not adequately studied or is not adequately understood, then a population gap exists in that case. The other gap that exists is what we call the temporal gap. Temporal gap. A temporal gap refers to a period of time where studies or findings are outdated or fail to account for recent developments. And in research, it signifies that studies may not be up to date or may not reflect the current state of knowledge and understanding in a particular field, and may be due to, among the following: one, outdated studies. That is, research that was conducted long ago may no longer be relevant due to advancements in technology, changes in societal norms, or new discoveries. The other one could be lack of recent data. Some studies may exclude most recent data or fail to incorporate new research findings, and this might lead to a gap in understanding. Again, failure to account for developments, new technologies, policies, or societal changes can also impact research areas, and studies that don't consider these developments might be considered as outdated. And therefore, filling temporal gaps ensures that research remains current, relevant, and utilizes the latest knowledge to explore phenomena more effectively. Let me give the example, say, of dating. There's quite a lot of questions around who is a good man? What are the qualities of a good man? What are the qualities of a good spouse? Assuming, for instance, in the 1970s, that's about 40 to 50 years ago, a study was conducted among females to seek to understand from them what they considered as the qualities of a good spouse. We know that over the years, a lot of things have changed. Education, formal education has spread both among men and among women. New technologies have emerged, new tests have emerged, and a lot of other things have been there. Therefore, findings of studies about qualities of a good man in the 1970s might not be exactly applicable 40, 50 years later, which is today. Therefore, in that case, there's a gap that we call temporal gap, so that somebody would be interested in terms of understanding what is it that today a woman would consider as the qualities of a good man. Are they the same or are they different from what women of the 1970s, 60s, and 80s considered? Therefore, there's a gap because of several changes that have occurred over the years. So that becomes what we call temporal gap. The other type of gap is called spatial gap. And a special gap in research refers to a lack of studies or underexplored areas within specific geographic contexts, particularly when research on a particular topic has been heavily focused in one area but is missing or limited in others. The exploration of special gaps involves studying topics that have been previously researched within specific geographical contexts but remain unexplored or underexplored in other regions. The absence of research in specific geographical areas may limit the generalization of such researches to geographical areas that have been neglected by the studies. And recognizing and addressing special gaps is crucial for a more complete and broad understanding of a research topic, particularly when geographical factors are significant. Therefore, bridging geographical gaps ensures that research is relevant and helpful across different regions and contexts. For instance, assuming that somebody studied uh, drug abuse among the youths in Europe, then the question would be, to what extent would findings of drug abuse among the youth in Europe apply to Africa, to Asia, to other countries? So that becomes special gap. This is because the characteristics of youth in one geographical place might not be the same across different geographical areas. There are geography-specific contexts that could shape certain behaviors and attitudes towards given practices. And that is why we normally say that it is important to understand that geographical location or geographical setting of a given area has the potential of influencing the kind of study findings that eventually are presented. Youths, for instance, in urban areas might not exhibit the same behavioral characteristics, the same tastes, the same attitudes towards a given thing compared to youths in a rural area. Youths in affluent families might not exhibit the same thing compared to youths in poor families. Youths in the Western world might not exhibit the same characteristics as youth in another area. And therefore, all these things, they need to be considered. So that's what we call special gap. And it becomes quite important because the geographical context of a given place has the potential of influencing behavior, and that one could have a direct impact on the study findings. So those are the various gaps that exist. In one study, you can list several gaps. It doesn't have to just be one type of gap. You can list several gaps to justify why the kind of study that you want to undertake becomes important. Thank you for listening to me.